Hello, and welcome to your May 2019 update training. Today we are going to cover a more in-depth look at Medicaid services in the community. Let's get started. Medicaid is a program that pays for essential healthcare services needed for certain groups of people with limited income, limited assets, and high medical expenses. Michigan has 33 Medicaid categories in total, covering newborns to seniors. We will take a look and discuss those programs that may affect clients who come to MAP for assistance. Medicaid is administered through the state, more specifically, the Michigan Department of Health and Human Services, also known as MDHHS. Contact information for local MDHHS offices are available online along with DHHS Eligibility Specialist contact information. To view that information, you can visit the links listed on the slide. DHHS uses manuals when making determinations of coverage. The manuals used are the BEM, Bridges Eligibility Manual, which contains policies and procedures related to determining program eligibility and the level of program benefits, such as non-financial eligibility factors, financial eligibility factors, and budgeting policy. The BAM, which is the Bridges Administrative Manual, and it contains policies and procedures related to activities such as administrative hearings, voter registration services, over and under issuances, and supplemental program benefits. The BPB is the Bridges Policy Bulletin log, and it contains definitions that assist with the understanding of the meaning and terminology used in other manuals rather than include definitions for the same terminology in each item. And lastly, the RFT, which is the Reference Table Manual, and it is exactly as it's titled. It's the reference manual and includes the following: the RFS schedules and RFT tables. All of these are available online at www.michigan.gov/DHS-manuals. The Medicaid programs that we see for individuals that come to MAP for services are for older adults and disabled adults. Each program has its own eligibility requirements listed in the BEM. The programs designed to assist those that are older or disabled adults living in the community are AdCare, also referred to as Full Medicaid, with more detailed eligibility requirements found in BEM 163, Deductible Medicaid, found in BEM 166, Medicare Savings Programs, also known as MSPs, Quimby, Slimby, OMBY, found in BEM 165, Healthy Michigan Plans, which may be referred to as Medicaid Expansion, found in BEM 137, Freedom to Work, found in BEM 174, 503 Individuals, found in BEM 155, Disabled Adult Children, DAC, found in BEM 158, Extended Care Nursing Home can be found in BEM 164. This is a category available only to LH and waiver clients who are age 65 or older, blind or disabled. LH refers to a Medicaid client who was in hospital and or long-term care facility in a hospital or long-term care facility during a month or more. My Choice Waiver can be found in BEM 106. Waiver provides home and community-based services for aged and disabled persons who, if they did not receive such services, would require care in a nursing home. Services provided under waiver must be less costly for Medicaid than the cost of the nursing home services for the total number of waiver participants, not per person. My Choice Waiver is not considered a Medicaid category, but there are special eligibility rules for people approved for the waiver program. PACE, also known as the Program of All-Inclusive Care for the Elderly, can be found in BEM 167. PACE is a managed care program designed for the frail and elderly population. Enrollment in PACE is always prospective, and the Medicaid Services Administration administers the program through contracts with PACE organizations. PACE is not available in all counties of the state. The Community Spouse Resource Allowance is splitting of assets for married couples when the spouse is not currently in and is not expected to be in a hospital and/or long-term care facility for 30 or more consecutive days, or is approved for a waiver or freedom to work program, or for a waiver client, the spouse is not also approved for waiver, and for PACE clients, the spouse is not also approved for PACE. Let's take a look now at eligibility. In order for an individual to qualify for Medicaid coverage, there are certain eligibility requirements that must be met. Each Medicaid category has its own special rules. However, in general, a person must meet the following. They must fit into the categories of people who qualify for Medicaid, and they must satisfy Medicaid's non-financial eligibility requirements and satisfy Medicaid's financial eligibility requirements and satisfy Medicaid's procedural requirements. Let's take a more in-depth look at what each of these requirements are. Medicaid's non-financial requirements are that the beneficiary must be a Michigan resident, and in BEM 220, the definition of Michigan resident can be found. It states that the Michigan resident is an individual who's living in Michigan except for a temporary absence. Residency continues for individuals who are temporarily absent from Michigan or intend to return to Michigan when the purpose of the absence has been accomplished. An example would be individuals who spend the winter months in warmer climate and return to their home in the spring. They remain Michigan residents during the winter months. Likewise, college students who attend school out of state but return home during semester breaks and for the summer can remain Michigan residents. The beneficiary must have or have applied for a Social Security number, and the beneficiary living in certain institutions are not eligible for Medicaid coverage. Examples of those not eligible for Medicaid coverage would be those incarcerated, in jail or prison. They are unable to use Medicaid services while incarcerated. However, once they're released, they can use Medicaid to pay for healthcare services approved by the Medicaid plan that they qualify for. The beneficiary also needs to pursue other means of getting healthcare benefits. An example would be making sure that they can get their employer coverage. Any refusal to pursue other benefit options will result in ineligibility. The beneficiary also needs to identify and inform MDHHS of any third-party payment sources, which will include workman's comp, Medicare, etc. For beneficiaries needing the extended levels of care, they must meet the level or care for nursing home and My Choice Waiver coverage. Medicaid has financial requirements for each program as well. There are general rules that govern how assets and income are treated during the eligibility process for all of Michigan's Medicaid programs. Each type of Medicaid program has its own unique income and asset rules or requirements, and we're going to review some of those now. Medicaid has what is considered to be a countable asset. These are assets that are taken into account when determining eligibility. The definition of assets includes cash, checking and savings accounts, and CDs. Personal property, which is defined as any item subject to ownership that is not real property. An example of personal property could be campers, furniture, clothes, or cars. Real property is defined as land and objects affixed to the land, such as buildings, trees, and fences. Condominiums are considered real property as well. Policies governing assets can be found in BEM 400, 401, and 402. So whose assets are counted when a beneficiary applies for assistance? Well, for a single adult, it doesn't matter who they live with, such as brother, parent, or unmarried partner. Only that beneficiary, that single individual's assets, can be counted. For a married person, the assets of the adult and their spouse who live together are counted. There are special asset rules that apply to couples when one spouse is in a nursing home, seeking My Choice waiver or PACE services, and this is called Community Spouse Resource Allowance and is covered in BEM 402. MDHHS caseworkers evaluate a beneficiary's assets in the following order. First, they identify each asset owned. They then review the BEM 400 to see how each asset is treated. They will determine the value of the asset, and then they will evaluate whether the value of the asset is considered countable. If the value of the asset should not be counted, it is because the asset is excluded by rule. It is not available, it is not salable, or it is affected by joint ownership. Non-salable refers to the process in which two knowledgeable appropriate resources, examples could be a realtor, banker, stockbroker, that live in the owner's geographic area, state that the asset is not salable due to specific conditions. Some of these conditions could include that the property is contaminated with heavy metals. This applies to any asset listed under investments, vehicles, livestock, burial space defined, employment and training assets, home and real property. And lastly, the caseworker is going to compare the value of all countable assets against the limit for that specific Medicaid countable asset limit. Not all assets are considered countable during the eligibility process. And again, assets are referred to as personal property, which is any item subject to ownership that is not considered real property. So again, campers, furniture, clothes, cars. Real property, which is the land and objects affixed to the land, such as buildings, trees, and fences. And again, condominiums are considered real property. Some commonly excluded assets include the homestead property, including all land attached, which could be an example of a farm, household and personal items such as fur coats, jewelry, etc., one vehicle, certain prepaid funeral expense and burial plots. These prepaid funeral expenses and burial plots must be purchased at the funeral home of choice and be irrevocable, or may be the life insurance funded burial plot. Rules, though, are very specific. And then lastly, the cash surrender value of life insurance policies owned by the same insured person with a total face value of $1,500 or less. You can see Appendix 2 in your resource guide for a listing of assets that may be excluded. Income is defined as benefits or payments received by an individual which are measured in money. It includes money that the individual owns even if not paid directly to them, such as income paid to a representative. Beneficiaries applying for Medicaid assistance income is counted as the following. For a single adult who's over 18, only that adult's income is counted. You do not count who they live with, regardless of whether it's a girlfriend, parent, brother, grandparent, etc. For married persons, the income of the adult and the spouse who live together is counted. The income of an absent spouse is not counted. Married persons also have special income rules that apply when one spouse is in a nursing home seeking My Choice waiver services. And again, this is referred to as the Community Spouse Resource Allowance and covered in BEM 402. DHHS caseworkers evaluate the applying beneficiary's income in the following steps. First, they identify each type of income received using their gross income numbers. They'll then review BEM 500 to 504 to see how the income is treated. They will then determine if the income should not be counted because it is excluded. And if the income is countable, they'll determine whether there are any deductions that can be made from the gross amount. And lastly, they'll compare the value of all countable income against the limit for that Medicaid program. Just like some assets are considered to be not countable, some income is also considered to be not countable. Examples of not countable income include reimbursements, which can include volunteer mileage reimbursements and foster, grandparent, and senior companion stipends. Income earned through the Senior Community Service Employment Program, also known as SCSEP. Education income, such as loans or grants. Up to $300 in donations received from nonprofits. VA aid and attendance benefits. Heating fuel supplier assistance or housing assistance. Tax refunds and credits. And in-kind benefits. Medicaid will also take into account deductions for certain types of countable income. Examples include, for those that are self-employed, allowable expenses of producing income can be deducted. For persons renting farmland, 10% of the rental payment or the landlord's actual expenses that can be verified may be deducted from the gross rental payment. And for persons who rent out part of his or her own home to another person, 60% of the actual rental payment or actual rental expenses that are verified can be deducted. Once the MDHHS caseworker has taken into account income deductions from BEM 500 to 504 for the applying beneficiary, they will then look into the following deductions for income in BEM 541 and apply it to the remaining countable income in this exact order. First, court order child support paid, not including arrear payments, work expenses for blind or disabled persons, an allocation for children who live with a parent or not on a government benefit program and are not a ward of DHHS, so an example, foster children, $20 of unearned income, which is per household, not doubled for couples, $65 plus 1/2 of the remaining earned income, and $60 for guardian or conservator expenses. We will now take a deeper look into the Medicaid programs that we work with regularly as MAP counselors. These can be found on your purple color aid. First up is AdCare, also known as Aged and Disabled Care, or full Medicaid. It is available to people who are over age 65, disabled, and have a net income that does not exceed 100% of the federal poverty level. It provides full Medicaid coverage, and a beneficiary must meet all financial and non-financial eligibility factors, where the income and asset limits can be found on your purple job aid. Federal law requires that DHHS must disregard the Social Security COLA increase when determining eligibility January through March of each year. The Medicare Savings Programs, also known as MSP, help to pay Medicare out-of-pocket costs. The beneficiary must have Medicare or be eligible to receive Medicare to qualify for MSP assistance. MSP consists of 3 levels of eligibility based on income up to 135% of the federal poverty level. Again, this information can be found on your Purple Job Aid. If a beneficiary is eligible for one MSP category, they cannot choose to take a different MSP category. So if they qualify for SLIMB and OMB and have been given SLIMB, they have to take SLIMB and cannot choose to take OMB instead. The 3 categories of MSP are QIMB, SLIMB, and OMB. We'll now cover more of these in depth next. The first Medicaid savings program available is Qualified Medicare Beneficiary, also known as QIMB. QIMB pays both Medicare Part A and B premiums, Medicare coinsurances and deductibles. Coverage with QIMB will begin the month following the DHHS processing month with no retroactive coverage. Beneficiaries must meet the income and asset limits and be entitled to Medicare Part A, either paying for that premium for Part A or free. Please refer to the Purple Job Aid for more information on income and asset limits for QIMB. The second Medicaid savings program available is Specified Low-Income Beneficiary, also known as SLIMB. SLIMB pays Medicare Part B premiums only. Coverage with SLIMB is available for the month the beneficiary applied with DHHS and retroactive coverage for up to 3 months prior to that. Beneficiaries must meet income and asset limits and be entitled to free Medicare Part A. Please refer to the Purple Job Aid for more information on the income and asset limits for SLIMB. The third Medicaid savings program available is Additional Low-Income Beneficiary, also known as OMB or QI, Qualified Individual. OMB pays Medicare Part B premiums only when funding is available. Coverage with OMB is available for the month the beneficiary applied with DHHS and retroactive coverage for up to 3 months prior within the same calendar year. So if a beneficiary applies for assistance in January of 2019 and is approved for January 2019, they cannot receive 3 months retroactive coverage because that would put that retroactive coverage in October, November, and December of 2018, not the same calendar year. Beneficiaries must meet income and asset limits and be entitled to free Medicare Part A. Please refer to your Purple Job Aid for more information on the income and asset limits for OMB. There are some special rules for OMBs. Beneficiaries eligible for full Medicaid are not also eligible for OMB. This includes My Choice Waiver, PACE, and long-term care beneficiaries. Beneficiaries eligible for full Medicaid can refuse full Medicaid and receive OMB only. And beneficiaries eligible for OMB at the time they meet their Medicaid deductible remain OMB eligible. Some things to note about DHHS is that some workers may not know about or understand the MSP programs. Bridges refers to this category as the Medicare cost share. Beneficiaries should provide a copy of their Medicare card to DHHS caseworker within 10 days of receiving and requesting MSP assistance, and a caseworker must act on any reported changes within 15 work days. More things to note about DHHS. Medicaid eligibility and begin dates must be added to Bridges. The worker needs to run eligibility, not just update the record. A notice of eligibility will be mailed to the client, including their beginning coverage date, and it can take up to 120 days to see the benefit on a Social Security check. So if we run into a situation where it may take up to 3 months for those premium payments to be on that Social Security check, a refund of the premiums paid by the beneficiary in the previous months will follow from DHHS. Some beneficiaries may qualify for what is called the Medicaid Deductible program. The Medicaid Deductible program is found in BEM 166 and 545. Beneficiaries must meet all non-financial factors and all financial factors except the income. The Medicaid Deductible program helps pay parts of large costs, such as hospitalizations. The Medicaid Deductible program has had the same protected income limits since the program started in the 70s. Even though limits have not increased over time, the program is still able to help some beneficiaries reduce the out-of-pocket medical expenses and qualify them for LIS, the low-income subsidy, also known as extra help. The deductible program is an optional Medicaid category in Michigan. To calculate the deductible amount for the beneficiary's net countable income must be more than the sum of the protected income limit, also known as PIL, and the total health insurance premiums that the beneficiary pays out. The difference between the income, the PIL, and the premiums paid out is the deductible amount. The beneficiary qualifies for Medicaid assistance once he or she incurs medical expenses equal to or greater than the deductible amount. Proof of the medical cost must be reported to the beneficiary's DHHS caseworker. The process starts all over again the next month to gain access to Medicaid assistance. We're going to look at Appendix 5 and Appendix 6 of our resources to determine what the shelter area is, as well as the PIL based on shelter area and household size. So for example, Joe Jonas receives Social Security income of $950 gross per month and $250 per month in pension, giving us a total income of $1,200 a month. To gather the countable income, we must also subtract the $20 disregard for Joe and a $60 guardianship expense that he provides. This gives Joe Jonas a net countable income of $1,120 per month. Now, if we refer to our handouts, we looked at Appendix 5 and Appendix 6 and found that Dickinson County is Shelter Area 3, and with a group of 1, as Joe Jonas is single, the PIL for him is going to be $350. And we'll estimate to say that his monthly insurance premiums total $230. When you take the $1,120 net countable income and subtract the $350 PIL and $230 monthly health premiums, it leaves us a deductible amount of $540 per month. That means that Joe will need to show $540 of healthcare expenses each month to his DHHS caseworker in order to gain access to Medicaid for that month. Meeting the deductible amount is a monthly process. Each month is a separate deductible period. Eligibility of Medicaid exists if one of the following meets or exceeds the deductible amount: an old unpaid bill for medical expenses for which the client is still liable can be used to meet the deductible for 3 months prior to the current month, or up to 6 future months. Current bills for personal care services in the client's home, in an adult foster care home, or home for the aged. Any bills for hospitalization, bills for copays and deductibles, bills for glasses, dental, and other uninsured costs. Allowable expenses for meeting the deductible are listed in BEM 545. Please note that a person does not have to pay an allowable expense for it to be counted against the deductible. All that has to happen is that the expense has been incurred. Old bills can be used only once to meet the deductible, even if liability still exists. DHS 114A deductible report can be used to report these medical expenses to the worker, but it is not required. And an expense that has been turned over to a collection agency is still a medical expense until the expense has been written off. So that can be one of those expenses that the beneficiary notes to their caseworker. So how does supplemental security income connect with Medicaid? Well, first, Social Security and Michigan have an agreement that if the beneficiary is determined eligible for SSI, the beneficiary will be automatically eligible for Medicaid. MDHHS local offices cannot open Medicaid for an SSI beneficiary. Medicaid eligibility will begin with the month of SSI entitlement, but coverage may be added for up to 3 calendar months prior. In MDHHS, Central Office receives SSI beneficiary information daily from Social Security Administration through their online data exchange. Other Medicaid programs we may encounter in our MAP counseling sessions include Healthy Michigan plans, found in BEM 137. Healthy Michigan plans are often seen with disabled individuals in their 24-month waiting period for Medicare, once being approved for disability through Social Security, and for beneficiaries under 65 without access to Medicare. These are often referred to as Medicaid expansion. Disabled adult child, also known as DAC, can be found in BEM 158. It is available to adults who were receiving SSI but are no longer because they receive SSA benefits under a parent's record. Medicaid is available to a person receiving Disabled Adult Children's RSDI, which is Retirement Survivors and Disability Insurance benefits that are under Section 202D of the Social Security Act if he or she is age 18 and older and received SSI and ceased to be eligible for SSI on or after July 1st, 1987, because he or she became entitled to DAC RSDI benefits under Section 202D of the Act, or they had an increase in RSDI benefits, and they are currently receiving DAC RSDI benefits under Section 202D of the Act. And note, to receive DAC RSDI, a person must have a disability or blindness that began before age 22. And lastly, they would have to be eligible for SSI without RSDI benefits. We may also run into 503 individuals found in BEM 155. This is also known as the Pickle Amendment. It's available to former SSI beneficiaries who receive SSA benefits and would still be SSI eligible if not for the COLA increase. Medicaid is available for former SSI recipients who receive RSDI benefits and are now eligible for SSI if RSDI cost of living increases paid since SSI eligibility ended were excluded. The reason for SSI ineligibility does not matter. Freedom to work, found in BEM 174, is available to a client with disabilities, is age 16 through 64, and has earned income. Eligibility begins the first day of the calendar month in which all eligibility criteria are met. All eligibility factors must be met in the calendar month being tested, and they may have to pay a monthly premium. Application. Now let's review the application process for Medicaid assistance. Beneficiaries can request assistance in person, by mail, telephone, email, online, and the local office must assist beneficiaries who need and request help to complete the application form. To report a refusal to assist, a beneficiary must call DHHS customer service at 517-373-0707. Please note that the phone number given to you is not the same as the one on the front of the DCH 1426 application. The beneficiary requesting assistance has the right to receive the appropriate forms. The DCH 1426, also known as the Application for Health Coverage and Help Paying Costs, is the single application for all Medicaid categories. They must also complete Appendix D for MSP and Medicaid. The date of the application is the date that the local office or scan center receives the required minimum information on the application. The minimum information needed is name, address, phone number, and signature. Electronically filed applications include applications filed in the MyBridges website, faxed, or emailed. The application is the submission of data regardless of the time it's received. DHHS must send a verification checklist informing the client that the application is incomplete or missing information. Medicaid applicants cannot be required to complete an in-person interview. The application date is retained regardless of how or when the application becomes complete. For retroactive Medicaid coverage, a beneficiary must meet all financial and non-financial factors in each month requested for the retroactive coverage. Having an unpaid medical expense incurred during that month, including any Part B premiums. They cannot consider bills that the beneficiary thinks might be paid by insurance as a paid bill. The beneficiary would have to have been entitled to Medicare Part A, and they must complete a DHS 3243 retroactive Medicaid application to capture income and asset information for those past 3 months. Verifications are documents or evidence to establish the accuracy of a client's verbal or written statements. DHHS must obtain verification when required by policy. Verification is required at application, redetermination, and reported changes when information is unclear or inconsistent. For Medicaid, verification of identity is not required. Income documents must be current within 30 days of the application. Verification checklist DHS 3503 is used to notify the beneficiary of what verifications are required to determine eligibility. DHHS must allow 10 calendar days for the beneficiary to provide necessary verifications. If the beneficiary cannot provide the verification despite a reasonable effort, the beneficiary may request an extension. The worker may extend the time limit up to 2 times. The beneficiary must obtain the required verification, but the local office may assist if they need and request the help. Beneficiaries will go through redeterminations. Redeterminations for Medicaid must be completed at least every 12 months. Medicaid eligibility will end unless a redetermination is completed in a timely manner and continuing eligibility exists. The redetermination month is at least 12 months from the date the most recent completed application was received. Redetermination does not require an in-person interview as a condition of eligibility. Per policy, OMB redeterminations are always completed September through December each year, even if the person first applied in August of that same year. For more information on this, you can find it in BEM 165, page 8. Hearings. Beneficiaries must receive a written notice of all case actions affecting eligibility or benefits. Information on the right to a hearing is included with these notices. Hearings must be requested within 90 days of case action, and hearing requests received within 10 days will stop any benefit reduction or closures. However, any benefits received may have to be repaid if the client loses the hearing. The local office must schedule a meaningful in-person pre-hearing conference with the first line supervisor within 11 calendar days. The client is not obligated to attend the pre-hearing conference. Scheduling the meaningful in-person pre-hearing is to explain the case actions and answer beneficiary questions to resolve the disagreement prior to a hearing. Administrative hearings have 59 days to schedule and conduct a hearing and render a decision. The beneficiary may request an expedited hearing when unusual circumstances exist. The beneficiary may also withdraw the request for a hearing at any time if they believe the actions were correct or the eligibility has been corrected. Most are scheduled as a telephone hearing, but a beneficiary may request an in-person hearing as well. The administrative law judge will review the facts and evidence and make a final decision and order, also known as D&O. A copy of the D&O will be sent to the beneficiary and to the local office if action is required by the local office. The local office then has 10 days to complete the actions. The hearing decision serves as the notice to the beneficiary. A beneficiary may request a rehearing or reconsideration. A rehearing is if an original hearing record was inadequate or there is newly discovered evidence that existed at the time of the original hearing. And a reconsideration would be a paper review of the facts, law, and any new evidence or legal argument. Estate recovery. Estate recovery started in Michigan on July 1st, 2011. Its purpose is to recoup any certain expenses paid on behalf of Medicaid recipients from their estates. This only affects persons over age 55 that received Medicaid to pay for nursing home care, My Choice waiver services, home health services, home help services, hospital services, and prescription drug services. Estate recovery does not affect anyone receiving MSP payments in most community Medicaid, except for hospitalizations. No estate recovery will occur until after the death of a surviving spouse or as long as the recipient has a surviving child who's a minor, blind, or disabled. The only assets that the state will attempt to recoup are those that pass through probate court after the recipient's death. Many assets do not end up passing through the probate court. Examples would be payable on death accounts, joint accounts, and property, etc. For more info, you can go to www.michigan.gov/estate recovery for more. If you have any questions, please feel free to reach out to your site coordinator based off of the county that you provide MAP services in. Thank you so much and have a wonderful day.